Well, hey, everybody, this is Robert, and welcome to this Outbreak newscast. Now, the Los Angeles County Department of Public Health reports investigating two unrelated cases of Baylisascaris procyonis, aka the raccoon roundworm infections, in children residing in the South Bay area of Los Angeles County. One patient had reported exposure to raccoons and raccoon feces, while the other may have been exposed at one of a number of locations with raccoon activity, including parks and the beach. Now, LA County Public Health says cases of human Baylisascaris is rare, with fewer than 10 cases reported in California since 1993. However, the parasite is prevalent in raccoons in the United States, with at least one study reporting 80% B. procyonis prevalence among California raccoons. So let's go through a little Q&A here with this. Pretty uncommon, not an everyday parasite. So what is Baylisascaris procyonis? It's also known as the raccoon roundworm. B. procyonis is the most common and widespread cause of clinical larva migraines in animals. It's a ubiquitous roundworm infection of raccoons, aka Procyon lotor, and is emerging as an important helminthic zoonosis primarily in young children. Baylisascaris procyonis and related species are large nematodes or roundworms of the order Ascaridia. Other more familiar ascarids are Ascaris lumbricoides, Toxocara canis, and Toxocara cati, the nematode parasites of humans, dogs, and cats, respectively. Infections in animals. The raccoon roundworm is indiscriminate in what animals it can infect, with more than 90 species of wild and domestic animals being identified as infected with the B. procyonis larva. Outbreaks of fatal central nervous system disease have occurred on farms, in zoos, and research animal colonies, and have affected commercial chickens, quail, pheasants, and domestic rabbits. Now, many times these animals get infected by getting the eggs in their fur and then ingesting the eggs during grooming. Now, in nature, small birds and mammals, particularly rodents, are infected by ingesting infective eggs while foraging for food at preferred sites of raccoon defecation. Now, when a species of animal other than a raccoon swallows these eggs, the microscopic larva hatches out of the intestine and then burrows through the wall of the intestine and begins migrating through the body, trying to find a home. The body tries to kill the larva and it moves rapidly to escape attack. The larva seems to have a preference for lodging in the liver, the eyes, the spinal cord, or the brain. Occasionally, they can be found in other organs. Now, when a larva tries to make a home, it causes a great deal of damage as the body tries to either wall it off or kill it. Eventually, it dies. It's reabsorbed by the body. In very small species, such as mice, it may take only one or two larvae in the brain to be fatal. If the larva does not cause significant damage in vital organs, then the victim will show no sign of disease. Species other than raccoon that are affected with this parasite cannot pass it on to anyone else. This is the end of the line for the larva, and it never becomes a mature adult capable of producing eggs. So, Baylisascaris procyonis in raccoons. Baylisascaris procyonis is indigenous in North American raccoons that are very common in rural, suburban, and urban settings, where they are well adapted living alongside humans. Raccoons thrive in areas where there is a permanent water supply, available food, and suitable sites for dens. Some of the highest raccoon densities are in and around suburban and urban residences and parks. Gardens, garbage cans, bird feeders, and pet food provide ample food for the raccoon. Now, in North America, the prevalence of Baylisascaris procyonis in raccoons is highest in the Midwest and Northeast, but it's seen in states all over the country. Baylisascaris procyonis causes little to no clinical disease in the raccoon. They become infected in one of two ways. First, young raccoons become infected by ingesting eggs during exploring and grooming activities with other members of their social group. Or two, the adult raccoons acquire the infection by ingesting intermediate hosts like rodents and rabbits and birds that are infected with the larva of B. procyonis. The disease in the intermediate hosts listed above makes them easy prey for raccoons. Raccoon latrines. Now, raccoons habitually defecate in communal sites called latrines. This can be natural or a man-made structure. Common urban and suburban sites include rooftops, attics, in and around chimneys, tree stumps, wood piles, decks, and lawns near trees. If there are many raccoons in the area, there are likely to be large amounts of resistant Baylisascaris eggs in the area. In the raccoon, adult females produce approximately 150,000 eggs per worm per day. The average raccoon sheds an average of 20,000 eggs per gram of feces. Because of the quantity and the resistance to environmental conditions, it is possible to have heavy and widespread contamination. So what's the risk to humans and what's the disease? Well, there are two factors that put people at risk for infection. One, of course, is contact with raccoons, their feces, or the contaminated environment. And two, geophagia or pica. This is eating dirt and other things that you wouldn't normally put in your mouth. Humans who accidentally come into contact with active or abandoned latrines are at risk. Young children are at particular risk because of their habit of placing their fingers or objects in their mouths. Larval migraines is the prolonged migration and persistence of helminth larvae in the organs and tissues. Disease manifestations of human Baylisascaris include visceral, neural, and ocular larval migraines. The clinical manifestations of severe disease include eosinophilic encephalitis, permanent neurological damage, ocular disease and blindness, and death. Let's talk about diagnosis. Now, there is no routine laboratory test considered diagnostic for Baylisascaris procyonis alone. Typically, clinical illness, exposure history, and an examination of the CSF for eosinophils are used. The use of MRI can also be useful. The use of serological tests can demonstrate anti-Baylisascaris antibodies in serum and CSF. Indirect immunofluorescence, ELISA, and Western blot are available at specialized laboratories. Ocular examinations may show larval tracts or the larvae themselves in the eye. Examination and identification of the larva in biopsy material is possible. However, this requires experience in recognizing larval morphological characteristics and the ability to differentiate from other nematodes, such as Toxicara and Ascaris, among others. Treatment. The preferred medication to treat Baylisascaris is albendazole. If albendazole is not immediately available, mebendazole or ivermectin may be used in the interim. Treatment should be initiated as soon as possible after ingestion of infectious material, ideally within 3 days. So prevention and contamination. Now, the best, most effective way to prevent infection with Baylisascaris procyonis is to not keep raccoons as pets and avoid contact with their feces. Learn to recognize raccoon latrine areas and either stay away from them or clean them up if necessary. Favorite spots are at the bases of trees, the forks of trees, on fallen logs, large rocks, wood piles, decks, attics, garages, chimneys, barns, and outbuildings. In addition, raccoons like to nest in haylofts and may contaminate hay or straw that is used for bedding or food. Purchase hay or straw from a clean source and dispose of any bales that show evidence of fecal contamination. Do not store the hay you buy in areas with access to raccoons. Be cautious using and handling fallen timber for firewood. Also, monitor children closely in potentially contaminated areas. Cover backyard sandboxes and block access routes for raccoons. Mothballs are known to be effective. Do not feed the animals and secure garbage. If you have a raccoon latrine on your property, cleaning it up can be very, very challenging. Baylisascaris procyonis eggs are very resistant to the environment and can survive for many years. They're resistant to all common disinfectants, including bleach. The best way to kill the eggs is through flaming the area, including soil, or burning affected materials such as straw or wood cages. Alternatively, boiling water can be poured over small areas at a time. In heavily contaminated areas, it may be necessary to remove and bury the soil in a deep spot elsewhere. When cleaning up latrine areas, proper protection is a must. The protection should include a dust mask over the nose and the mouth, disposable clothing, disposable gloves, and heavy rubber boots that can be cleaned with boiling water. To close, I would just want to say the LA County health officials say that while Baylisascaris is rare in people and the risk to the general public is low, it is concerning because a large number of raccoons live near people and the infection rate in raccoons is likely quite high. The confirmed cases of this rare infection are an important reminder for all people in LA County and elsewhere where there's raccoons to take precautions to prevent the spread of disease from animals to people, also known as zoonotic diseases. Thanks for listening.